Hi, I am Dr. Nitin Prabhudesai. I am a practicing ophthalmologist in Kothur, Pune for the last almost 25 years. My specialization is retinal surgery. However, I would also like to see patients who have common eye problems. Today, we will be discussing about a problem or about a treatment known as Lasik. Lasik is basically a refractive procedure. Now, what do we mean by refractive procedure? All of us may have some form of an optical problem. The common optical problems which we can face are myopia, hyperopia or astigmatism. At a younger age, we use glasses to correct these problems. But as we get older and our glass power stabilizes, we can use laser correction to correct these problems. And one of the most popular form of laser correction is known as Lasik. Lasik is one of the most used procedure all over the world and it has been used in millions of cases. It is very stable and very predictable. However, one should remember that Lasik is not for all. Every person who intends to undergo this treatment needs to have a thorough eye checkup from his or her ophthalmologist. The ophthalmologist determines that his eye is fit for the procedure and his refractive error is not unstable, in the sense that he should not have a change in the glass power for last at least 1 year. Usually this procedure is advised for people who have stable refraction by age, that is not before 18 years, and usually after that it can be done at any age, but commonly it is more useful for youngsters who do not have glasses for reading purpose. In Lasik, what we basically do is, if you look at this eye model, is treat the front part of the eye, the transparent part called cornea. If you can see in the cross section that the cornea has certain thickness. So to correct the glass power, we change the thickness of this cornea with the help of laser. Why do we need the laser? Because the change is in microns. We have to make these changes very precisely and very perfectly, and hence this can be performed only with the help of laser, which is very accurate. So once we decide that a person needs Lasik treatment, we make him undergo certain tests to make sure that his cornea can withstand the changes which we intend to do in it. If the cornea is okay with the form of treatment we are deciding, then we advise the person to undergo the treatment. Also, we'll have to rule out that he does not have what is called as dry eyes. If he has less production of tears in his eyes, then he may not be a good candidate to undergo this procedure. Also, certain systemic diseases like diabetes, hypertension, though they are uncommon at younger age, can be a contraindication for doing this treatment. So in short, anything which will change the refractive status of the person would not be a good condition to consider for Lasik treatment. Once we decide that a person is fit for Lasik treatment, then the person has to undergo just a routine evaluation to rule out any active infection at this stage, and then he is ready for the treatment. The treatment takes only a few seconds, where we create a flap of the upper part of the cornea. Then on the base of the flap, we would use the laser to reshape the cornea and then place the flap back into its position. This makes the procedure very simple, fast and predictable. The patient recovers fairly clear vision without glasses the next day. Does the patient have to take care after this Lasik treatment? Yes, immediately following the treatment, the patient has to use certain drops for a period of 3 to 4 weeks, and we expect that he does not do very adventurous activities like diving in sea water or bungee jumping for the few weeks following the treatment, because in the meanwhile the cornea, the flap of the cornea heals well, and after that he would be having no problems throughout his life. We also advise these patients to use lubricant drops for the next few months because the Lasik may induce some amount of dryness which gradually recovers with the use of lubricating drops. With this, I think we have discussed more or less all the points regarding Lasik. If you have any concerns about it, you can contact us through Lybrate. Thank you.